The Clinical Competency Exam, or CCX. A clinical competency exam consists of a single case or multiple case encounters with either standardized patients or virtual patients. You will use the CCX program to document your patient's history and physical findings, to order and interpret labs, to match findings to diagnoses, to make a final diagnosis, and to complete a patient management plan. We will begin with a standardized patient case. You collect the interview and physical exam data from the standardized patient, for example, asking history questions and performing a physical exam. You will make note of your findings and form preliminary diagnoses. You will enter all the findings and diagnoses in CCX during or after the patient encounter. If a standardized patient is not available, a virtual patient case may be used to administer the CCX exam. As an example, this is how you would conduct the virtual patient interview. You will select a category of questions, select a specific question in that category, and review what the patient has to say. You will document your findings as you are conducting the patient encounter. For instance, you will enter history and physical exam findings pertinent to the patient's chief complaint. Also, you will list your possible diagnoses which you think explain the patient problem. You will edit, add to, delete from, and rearrange the items on these lists throughout the patient encounter. The findings and diagnoses lists are collected, reviewed by the instructor, and scored. In addition to the interview, the virtual patient version of CCX allows you to collect findings in a virtual physical exam. Click to select the exam tool, click a body part, review the results, and type in your interpretation of the finding if required. Your interpretations as well are collected and can be reviewed and scored by the instructor. As we mentioned earlier, you will edit, add to, delete from, and rearrange findings and diagnoses throughout the patient encounter. You may switch between the interview and the exam during your encounter with the virtual patient. We will now show the CCX features that can be used in both standardized patient and virtual patient cases. All CCX users may order diagnostic studies or labs for either virtual patients or standardized patients. The CCX Labs database includes all possible diagnostic tests for a primary care encounter. There is a list of common tests to choose from and review. Also, there are categories of specialized tests to order. After you select the labs you want, click the Next button to go to the results screen. Click each lab test to see the results. Type in and enter your findings from the labs. You may request additional labs. Click the Next button to advance to the final diagnosis. When the encounter is complete, you would list your possible diagnoses which you think explain the patient's problem, and associate all your findings with individual diagnoses in your list of most likely diagnoses. You will see all of the possible diagnoses you listed when you make your final diagnosis. Click each diagnosis to see the list of findings you associated with each diagnosis. You will select a final diagnosis based on your investigation and write a final diagnosis justification. Your final task in the patient encounter is to describe a management plan. You will start by choosing outpatient therapy or hospital admission for your patient. You may be required to enter in each management item using your own wording. Also, you may be able to select from a list of management items. Creating the management plan is the last step in the CCX patient encounter. The instructor reviews each set of findings, interpretations, exams, selections and input, and scores individual student records.